share my screen. And I should pick. Yeah, I don't know if it's going to work. Let's see. Can you see that?
I'm still just seeing. No, it's coming. Yes, now I can.
Okay.
You can see it.
Okay. How long it takes to load. Okay, so it takes a few seconds, but I think it'll catch up. Okay, so we can try that. You want me to go ahead and stop sharing for a second?
Yeah, I think you
Yes.
need to stop the sharing, I believe.
Yeah.
Okay. Yeah, and now we're back to the PowerPoint, and then
Yep.
Rebecca can take
And I'll
over.
take over and do my talking, and then we'll turn it over to you.
Okay, sounds good.
Cool.
Good morning, everyone. I'm Rebecca Vickers, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to the presenter and me, the host, by using the chat panel. The button to open the panel is usually located in the lower right side of your monitor. Please use the chat panel to send any questions you may have as you think of them, and the presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options will be posted in the chat panel throughout the presentation. If you continue to experience poor audio through your computer, try rejoining the webinar and use the I will call in telephone option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on FADA's website within 30 business days. To access the recording and PowerPoint, go to www.fada.org, then to our Resource Center, and then on to our training library. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credits for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on FADA's website. You will first need to register or sign in to your account to complete the evaluation. Information you provide FADA as a part of registration remains confidential. Statements of credit will be posted 30 business days after the evaluation closes for persons completing the evaluation and attending the full webinar. Please remember, completing the evaluation is necessary to receive CE credits or to access your statement of credit. Do note that the evaluation will close midnight, Tuesday, January 10th. Up to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, you needed to include your Florida license numbers for reporting to CE Broker when you registered for this event. If you are certified with the Florida Certification Board or licensed outside of the state of Florida, you do not need to provide your certification number when you register with our site. Please note that WebEx monitors arrivals and departures of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credit. And now I'd like to introduce our presenter for today, William King. He currently serves as a Housing and SOAR Entitlements Coordinator for the managing entity Broward Behavioral Health Coalition. William has over 23 years of experience with Henderson Behavioral Health as an intensive case manager and housing service coordinator for homeless individuals with behavioral health conditions, where he oversaw a variety of housing case managers for single-room occupancy apartments, PATH, supportive services for veteran families, and case manager within a 35-bed homeless shelter. He has worked collaboratively with the local housing authorities on a Shelter Plus Care certification, Section 8, and mainstream housing certificates. William also helped create 93 supportive housing placement opportunities for individuals transitioning out of residential treatment facilities and assisted with bringing in a new 100-unit affordable housing development to Broward County. William graduated from the University of South Florida with a Bachelor's of Psychology, is a certified SOAR trainer and a SOAR local lead for the Broward County area. And now I'll turn the presentation over to you.
All right, thank you so much, Rebecca. I really do appreciate everybody that's in attendance today. I was invited to do this presentation because I've developed this PowerPoint training for our local case managers, peer support specialists, housing navigators here in Broward County. We use it and they use it as a resource tool, and that's what I'm hoping that you all will be able to use it for as well. And I have developed this to kind of coincide with the issues and the things that go on in the state of Florida. So I'm again very thankful to be a part of this and to be able to present this training to you all. And of course, if you have any questions throughout the presentation, like Rebecca said, please put them in the chat and we will try to address the questions as time permits. So again, I am actually, my new title is now Director of Housing and SOAR Entitlements. Pretty much, I work for the managing entity in Broward County. So essentially, we are tasked with handling the funding that comes down from the Department of Children and Families, and then we contract with the substance use and behavioral health agencies here in Broward County. So again, this This PowerPoint is going to be, you're going to have access to this. You're going to have a copy of it. So a lot of the hyperlinks, or all of the hyperlinks that are within this PowerPoint presentation, are going to be able to be used for resources. So some of what I want to present today is we have a lot of individuals that we work with that have substance use or behavioral health issues, are experiencing homelessness. They need some different levels of care in regards to residential treatment, that sort of thing. So this PowerPoint, this presentation is going to take us through a lot of those level of cares, what kind of options they have in trying to get people linked with the proper housing situations for them. So without further ado, we're going to get started. These are just some basic terms that we utilize when we're talking about individuals that are receiving HUD funding, Continuum of Care. So the area median income, the AMI, HUD establishes income limits according to family size and are defined as extremely low income, which is 30% of the area median income, which is most of the individuals that we work with that receive SSI. So it is the very low income. SSI currently actually just was adjusted, is $914 a month for those recipients. Very low income is 50% of the area median income, and low income is 80% of the median income. Each of the communities throughout Broward or throughout the state of Florida has a continuum of care. Fortunately, we only have one COC, which is a regional or local planning body that coordinates housing and services funding for homeless families and individuals. Some communities, say up north, have multiple COCs. We're fortunate enough only to have one COC, but we're going to go through on this presentation and explain kind of what a COC does, how to access the services and opportunities for our individuals that we work with. Coordinated assessment and housing placement, which basically is a coordinated system which people experiencing homelessness are assessed, prioritized, and moved from the streets into the best housing options for their needs. And of course, the homeless management information system, which is generally used throughout the country, most definitely used throughout the state of Florida. Basically, it's computerized data collection tool designed to capture client level information over time, and it's used by the coordinated entry teams to assign people to various housing providers. So, and of course, we're going to talk about public housing authorities, how to access those public housing authorities, what kind of services and housing options are available for people that are, experiencing homelessness or maybe are transitioning out of residential treatment. So we're going to go into some of the public housing authorities, how to access the public housing authorities in your area and actually throughout the country. And then one of the tools that is used often throughout the country is the Service Prioritization Decision Assistant Tool, the VIs for that, basically. It's an assessment tool that we use here in Broward. I know it's used throughout the state of Florida. It's essentially a questionnaire that's given or asked of individuals that are experiencing homelessness. Basic questions like, how long have you been on the street? Do you owe people any money? Have you had contact with hospitals or contact with the police? And essentially at the end of the evaluation or the assessment, it gives us a number. So the higher the number, the more vulnerable that person is considered. And those individuals are generally prioritized when it comes to assigning them to housing vouchers or certificates within a continuum of care. And of course, U.S. Department of Housing and Urban Development, HUD, was basically established in 1965. HUD's mission is to increase home ownership, support community development, and increase access to affordable housing. All right, I think I have a question. Sound is very strange. Mic needs to be closer to speaker. Is everybody having we're going to work on trying to fix that problem, and I will try to talk closer. Hopefully that will help, okay? All right, so these are some examples of how the HUD funding comes about. So essentially each community in Broward County or actually each community in the state of Florida has an assessment day, or actually it's broken down into 3 days that we do a point in time count. So essentially there's 3 days that are set aside generally in January, ours is coming up here soon, where we canvass Broward County, and we try to interview and assess as many people that are experiencing homelessness as we can. Those can be people that are in the jails, they could be in the homeless shelters, residential treatment programs, on the street, actually on the street. So essentially we're trying to get a count of those individuals that are experiencing homelessness in our community. Because what that does is we provide those numbers to HUD, federal government, and then HUD provides our community and yours community with funding to assist in trying to place those individuals with the public housing authorities. So here in Broward County, we have 6 public housing authorities, but essentially this link here will take you to, once you have this PowerPoint presentation, it will take you to all of the public housing authorities in the state of Florida. The second link here will take you to all of the public housing authorities in the country. So I'm actually going to click on, let's see if I can find it. Let's see. All right, we're gonna, you know what, we're gonna go back to, I'm gonna cancel that. So I was gonna try to demonstrate what you can see on there, but basically it's a list of every public housing authority in the state of Florida. It has the contact information, phone numbers, their web address, and that sort of thing. So it's a very good tool to use if you're trying to locate the public housing authorities in your area. So essentially HUD provides the funding. Our HIP administration, which is now the HOSD, the Housing Option Service Support Division, handles the funding that comes down from HUD, and then the funding is distributed throughout our housing providers in our community. It works the same way in your communities as well. So one of the things we talk about when we're talking about working with people that are experiencing homelessness is obviously the criteria for homelessness. So HUD establishes a definition for certain categories of homelessness, and these are the categories. So category 1 and 4 are the categories where we're allowed to enter them into the homeless management information system. So category 1 are individuals or families who lack a fixed, regular, adequate nighttime residence, meaning has a primary nighttime residence that is a public place not meant for human habitation. So that could be living on a park bench, in the encampment, living in a tent outside, is living in a public or privately operated shelter. So individuals that are in the homeless shelters, transitional housing, congregate shelters, hotels that are paid for by governmental entities or charitable organizations, those individuals can also be considered homeless. We're seeing a lot more homeless families being put up in hotels because of the high cost of rents that we're experiencing here in the state of Florida and across the country. A person that is exiting an institution where he or she has resided for 90 days or less, who has resided in an emergency shelter or a place not meant for human habitation immediately before entering that institution. So essentially, if they're homeless prior to going into, say, jail, then they maintain that homeless status, which is why when we do the point in time count, we actually count individuals that are in jail that meet that criteria. Category 2 are individuals and families who will imminently lose their primary nighttime residence, provided that a residence will be lost within 14 days of the date of application for homeless assistance. No subsequent residence has been identified, and the individuals or families lack resources, support networks needed to obtain other permanent housing. Category 3 are unaccompanied youth under 25 years of age, or families with children and youth who do not otherwise qualify as homeless under this definition, but who are defined as homeless under other listed federal statutes. have not had a lease, ownership, interest, occupancy agreement in permanent housing during the past 60 days prior to this homeless application, have experienced persistent instability as measured by 2 moves preceding 60 days, can be expected to continue such status extended period of time due to special needs or barriers. And then lastly, the category 4, any individuals or families who are fleeing or attempting to flee domestic violence situations, has no other residence, and lacks the resources and support to obtain permanent housing. So that's the HUD definition that we go by when we're trying to link individuals with the coordinated entry and continuum of cares. And there's various aspects of homelessness, and we'll get into those housing vouchers and certificates that can relate to that. So these are some types of HUD-funded housing programs. So housing choice vouchers, Section 8. I'm sure all of you have heard the word Section 8 before. So these are generally provided by the public housing authorities, and entry point is a lottery or a wait list system. So eligibility is determined by household income up to 80% AMI. Citizenship status and criminal activity are also considered when applying for these types of housing. They assist elderly, disabled families. These can be used in scattered site private rental market, meaning it's not one building that's set aside for Section 8. These vouchers or certificates can be used within the community as long as the landlord's willing to accept them. The good thing about these vouchers are the tenant only pays 30% of their income towards rent plus utilities. So the way these work, a lot of housing authorities have long waiting lists. We all know they have wait lists. So in the olden days, you used to be able to go to the housing authorities and apply for, put your name on a wait list, that sort of thing. Because there's such a long wait list at a lot of the public housing authorities, the way it works now is the public housing authorities will put out an announcement, and they'll say, for instance, for example, January 10th, we're going to open up our Section 8 wait list. So essentially, here in Broward, 8,000 people will call for that Section 8 wait list. So those 8,000 people will call or log into the computer, depending on how the housing authority wants people to apply. So they'll call, log in that one day or 2 days, however long they've extended the opening for, and then essentially they'll do a lottery drawing. So they'll draw down those 8,000 names to 500 names, and those 500 names are then checked by the housing authority staff to see whether or not they actually meet the criteria for that specific housing voucher. It may be that they're required to be disabled. So they would look to see, the housing authority would look to verify that person or family has somebody that's disabled so they can qualify for that housing voucher. So from those 500 names, they'll titrate it down, get everybody that's qualified for that voucher, and then they'll sit there and wait, because a lot of the housing authority vouchers, they're not going to have 500 at one time. They may get 39, mainstream housing vouchers per year or something. So it's very tenuous to apply for these types of housing, but it is a good option. It's highly recommended to, if one of these announcements come out in your community and you have individuals that are looking for apartments and trying to get them some housing assistance, it's a good idea if they meet the criteria to try to get them on that list, because you never know when their name may be called. Again, these are some of the other types of housing. These are permanent supportive housing, Continuum of Care. So you access these through the Continuum of Care. Coordinated entry team. So eligibility is determined by household income, verified homeless history. So this is where the HUD definition for homelessness comes into play. Verification of disabling conditions. A lot of these housing vouchers require that an individual has a disabling condition. citizenship status, and criminal activity are all considered or taken into consideration for these types of housing. Again, these are also scattered site housing subsidies, but they're provided with conjunction with supportive services. So the housing authorities will provide the certificate, the funding, the subsidy, so to speak, and then they will contract with either behavioral health organizations, housing provider organizations, to provide case management or peer support services, because part of these vouchers require case management services. Tenant only pays 30% of their household income towards rent plus utilities. Some examples of these are the Shelter Plus Care vouchers and the Veterans Affairs Supportive Housing, so the HUD VASH vouchers. These are set aside for veterans, but the local housing authorities do handle these vouchers. Here's some more. Rapid rehousing is, again, another opportunity. This is usually short-term money that is provided to individuals or families. So entry point, again, is through coordinated entry. Eligibility is determined by household income and housing status. Serves both individuals and families. Participants receive up to 24 months of housing assistance. It used to be that it was about 1 to 6 months of assistance for this type of housing. But what we found is that individuals that were placed in these rapid rehousing situations, the subsidy would be paid. An individual or family would be paying only, say, 30% of their income towards rent, and then slowly, over the 6-month to a 12-month period, the subsidy would be titrated down to actually zero, and then the individual or family would be responsible once that assistance stopped to maintain their lease, maintain their payments. But what we're finding is a lot of people that were in this type of funding, after 1 or 2 or 3 months when the subsidy stopped, they were literally returning to homelessness. So we here in Broward have moved towards extending that period of rapid rehousing assistance up to 24 months. And then we're also working, because a lot of money is put up front to keep people housed in these types of situations. So what we're also trying to do is, if it looks like a family is not going to be able to maintain their current lease once the funding stops, we're looking to move people into more permanent housing voucher certificates and transitioning them into a PSH or permanent supportive housing certificate that is more long-term, ongoing assistance for families, especially in this day and age. Unfortunately, the housing costs in Florida are astronomical. We have some of the highest costs here in Broward County, Miami-Dade, West Palm Beach, have some of the highest costs in the country. So it is essential that we try to locate housing assistance for our individuals that are, very low income, receiving SSI. So some of these types of housing here, Hope South Florida, Salvation Army, United Way, SSVF programs are some of the programs that offer this type of housing. And then some more types of housing that we utilize for our behavioral health and substance use individuals. Transitional housing, again, this is accessed through the COC. Entry point is through coordinated entry. So essentially how coordinated entry works is we have community members, agencies can fill out a referral, and then those referrals are placed into the homeless management information system. And then we have a centralized coordinated entry team that goes through those referrals. They can see the vacancies, they can see what housing provider has vacancies, and then they essentially will assign that individual or family to the housing providers that have openings. So eligibility is specific to the grant requirements. So a lot of this funding has grant requirements. So an individual may have to be homeless, have a substance use disorder, or mental health illness. These are site-based and time-limited. Housing is provided in conjunction with supportive services. So the housing and case management or peer support services are necessary in order to be a participant in this type of housing. And then, of course, if a person is homeless upon admission, they lose their homelessness status if they're in a transitional housing situation more than 90 days. This is important because if they do go past that 90 days, then they would no longer meet the criteria for some of the other housing vouchers that are out there for shelter plus care, maybe some of the mainstream housing vouchers. So it is essential that individuals that go into transitional housing generally have more of a opportunity and plans of becoming more financially independent, and they may be working, not necessarily depending on SSI, have work histories and things like that. These are some of the non-funded housing programs that we have here in Broward. The reason I included these and left these in this training is because I know there's a lot of ME managing entity providers and that are on this call. So we have our respite providers and transitional housing providers, our FARR Certified Recovery Home providers, are very much willing to lend their knowledge of how to grow this type of housing in your area. So this is why I left it on. This Homes United respite program, it was born out of part of my job is to kind of have the system flowing, right? So where we were having some backlog is the acute care facilities. An individual may have been Baker acted into the hospital, and the hospitals generally are recommending they say residential treatment. So our residential treatment programs often and frequently have wait lists. So what the hospital has been having to do, unfortunately, is discharge people to the task force. Our task force here in Broward County is basically the gatekeeper to the homeless shelters. So the hospital will discharge somebody that literally just got out of the acute care facilities, and they'll be placed, go to a pickup point where the task force meets with them, assesses them, and then tries to get them into a homeless shelter. So we have multiple homeless shelters here in Broward County, but there's always a wait list. So the task force may only receive, say, 10 beds for one night. So if you have 50 people showing up for those 10 beds, 40 other people are still going to be on the street. So, these are the most vulnerable individuals, high utilizers that are coming out of the hospitals. So we developed a partnership with this organization, Homes United. They are a faith-based organization. And so we have a respite, a transitional housing situation. So essentially, as long as an individual is waiting for, say, a residential placement, they've been screened, there's just a wait list for them to go into residential treatment, or they're waiting to go into an assisted living facility or some other, maybe even a family member's home, we can take them into our mental health respite program or transitional housing program while that bed, waiting for that bed to become available. So this helps the hospitals with discharges and alleviates people from being discharged to the street. Another thing that we kind of develop with them too is because residential treatment programs, what we find that once they're completed residential treatment, they've graduated, there isn't a lot of places for individuals to go. There used to be a lot more opportunities, things like that. We've had a lot of assisted living facilities closed down in our area, which is happening all over the state. So we came up with this agreement with this housing provider, Homes United. It's basically a bridge program. So essentially, an individual that's graduated from residential treatment can now go into this bridge program where they can continue. There is a case manager and a SOAR specialist that works within this bridge housing program. And that essentially they can graduate from residential treatment, go into this residential bridge program and continue to work on, say, applying for Social Security benefits, or if they're wanting to work, they can work with some of the supported employment programs, the IPS, individual placement support services that we have. And so it kind of alleviates and frees up space in the residential treatment program. What we're finding in these types of housings when they're coming in and having to wait for residential treatment, they're doing really, really well in this type of environment. It's a house. They're scattered throughout Broward County. Actually, they're throughout Palm Beach, Broward County, and Port St. Lucie. So, you know, these types of housing, the individuals are thriving in. So a lot of them essentially are avoiding going to residential placement and going into self-pay in these in these transitional housing beds. And they're much, much more affordable than, say, an individual apartment and residential treatment. Residential treatment is one of the highest cost to our network because it's very expensive to keep somebody in residential treatment, and residential treatment is time limited, very time limited, and we're going to go into those parameters later on. So these are, and I wish I could get to clicking on the FARR certified. So we have same kind of situations with agreements with individuals that may be experiencing substance use or co-occurring disorders. We have FARR Certified Recovery Homes that we are contracted with, that we have agreements with to provide respite stays while they're waiting to go into, say, substance use treatment or residential treatment. We have placement for those individuals that may be coming out of jails, coming out of the hospitals, to stay while their next placement is coming available. So when you get this PowerPoint, the FARRonline.org link will take you to the FARR website. So the Florida Association of Recovery Residents, they are the ones that do the certification for these homes. So this website is really, really useful. It brings up the entire state of Florida. You can click on it and go to whether or not you're trying to, say for instance, you have somebody that's in MAT treatment, medical assisted treatment, somebody that needs Suboxone, and they're trying to titrate them down. Some FARR facilities will not take people with MAT, but if you look on their FARR website, you can click on there, you can add that parameter as one of your search options to say, yes, does it take MAT? You put yes, it will bring up all the facilities, the FARR facilities, recovery homes that take that individuals experiencing or working with the MAT programs. So it's a very, very useful tool. Highly recommend going to it once you receive this PowerPoint. I want to keep this PowerPoint it's a resource guide, really, because all the hyperlinks do work, and you'll be able to refer back to this once you get it in your hands, and then click on those links. Project SOAR, this guy actually is very, very willing to lend his knowledge of running these businesses, running these types of recovery homes. So, which is why I left this information in here. His contact information is as well as in this slide. He has been a huge help to our community and is always willing to help other communities as well. Basically, he has FARR certified homes that he runs strictly for male right now, but we do have some other recovery homes that we work with that provide services for women as well. This Project SOAR also just brand new, just started an LGBTQ house as well. These houses are, again, they're scattered throughout Broward County, and essentially they are a good option for individuals that are experiencing substance use issues. Oxford House. I'm not sure if everybody's heard of Oxford House, but this is another self-run, self-supported recovery houses. They are definitely throughout Florida. This is a good option for individuals that are experiencing substance use issues. We recently, within the last, I'd say 2 years, have gained 3 houses here in Broward County. They never were down here before. They had a real tough time, getting into our community because the rents are really high. So essentially, Oxford House rents houses in the community and then provides a safe, self-run, self-supported recovery house. They are not FARR certified, but if your organization is contracted with the MEs in your local area, the managing entities, if you're contracted with them, you're able to place individuals in these types of housing and use funding, incidental funding to pay for that housing as well. They're grandfathered in. This organization has been around since 1975. This Oxford House website is excellent. If you go to it, you can click on anywhere in the United States. They're all over the United States. If you're looking for a house in Mississippi, you can click on the houses in Mississippi. It'll show you their vacancies. It has the housing person, the contact information. It has the address of the house, as well as a photo of the house, what it looks like, the neighborhood that it looks like, you know, where it is located. So it's an excellent, excellent resource for those individuals that are maybe co-occurring, experiencing substance use issues, and need a safe place to stay. Let's see. Again, these are some of the other options that we have developed here. I left this slide in because, again, this was when I worked at Henderson. We developed these 93 or 83 transitional permanent housing spots for individuals that were coming out of residential treatment. So essentially, you know, when they were graduating from residential treatment, there wasn't a lot of places for people to go. And the rents were more than they could afford on their SSI or their work money. So we came up with this program to essentially subsidize individuals to be able to move into their own apartments. So we have, you know, we've developed this out of a need or gap. We tried to fill a gap in this situation. It's been around since 2016. It's pretty much always full because individuals are doing really well coming out of residential treatments and going into their own apartments. But this may be something that you can add to your community as well. We are definitely more than willing to provide information on how this works for those that are interested. And again, my contact information is there for anybody that's on this call to contact me to kind of brainstorm if we need to. Again, this is, I'm not sure if everybody's gone to this. A lot of times when I'm doing the trainings for even seasoned case managers that have been around for a long, long time, they don't know about this website. This is the ACA website. And if you click on this link, it will take you to a facility finder page. And essentially, if you say you're looking for an assisted living facility and you're looking for Broward, well, not even Broward, let's say we're looking for Madison County. We want to see what assisted living facilities are available. These are licensed facilities, okay? So you click on Madison County, there's parameters where you just put them in. It'll bring up all the licensed assisted living facilities in Madison County. And then essentially you can look at whether or not they have limited mental health license beds, whether or not they've had inspections or failed inspections. It gives the address of the place. Somebody asked, I'm going to actually answer that question. How long is the stay at Oxford House? It's indefinite, really. As long as an individual has the ability to pay and they're getting along in the household. The household actually, Oxford House run, the households are kind of democratically run. So the people in the household determine whether or not a person stays, or if there's some issues going on, they get together as a group and they talk about it. And essentially, if there's a lot of disruption that's going on with, say, an individual, they may give them an opportunity to straighten that disruption out. But it's very democratically run, and they can stay indefinitely as long as they have the ability to pay. So this, again, I highly recommend going to this website. This website can take you to nursing homes, you name it, any licensed, ACA licensed facilities. It's an excellent, excellent tool to utilize when you're trying to find housing placements for people that are experiencing behavioral health issues or substance use issues as well. And this also can take you to medical clinics, that sort of thing. Okay. So this is born, some of these programs that I have listed here are born out of gaps, right? So this adult resident community, or ARC LLC, is a transitional housing option. This is actually started by Project SOAR in coordination with Broward Behavioral Health Coalition, who I work for. Project SOAR is the recovery home that I spoke about a little earlier that has some of our transitional and respite beds that we contract with. So essentially, these ARC housing is designated for individuals with mental illness who may have mental health or co-occurring substance use diagnosis and need a safe place to live while transitioning. So Mike Allback is the person that runs Project SOAR, and he runs these adult residential communities. What he was finding is individuals that were experiencing behavioral health issues really needed to have their own separate space as opposed to being linked or combined or living with those individuals that are maybe just experiencing substance use issues. So he came up with this ARC residential community. Again, he's more than willing to help other communities add this to their portfolio, so to speak. They do have some exclusions. No one in a medical crisis. All individuals must be able to manage their ADLs because these are not locked facilities. These residential recovery homes, they're not locked. Okay. And again, temporary housing for 1 to 6 months, and then we do pay for some of these beds if we have to. So BBHC is the managing entity. So we work with the underinsured and the uninsured. So individual that has maybe Medicaid or Medicare might not necessarily receive services from us. Our purpose is to provide services, or our agencies that we contract with provide services to the uninsured individuals or the underinsured individuals within the community. And part of what we do is try to help people get benefits if they qualify for it or get back to work, So these are just some of the examples of what goes on in an ARC transitional housing. Individuals will be provided with technology. So this was during the pandemic. They had access to computers to do telehealth and that sort of thing. There is a food pantry, so these individuals can cook for themselves within the home, which makes it more of a home environment. And then they also offer peer recovery support services in this type of housing, which is a really, really, really good resource for individuals because they can actually drive people to their appointments, make sure that there's job information sharing, connecting clients with social services and other resources. So there's a lot of services that go on within these ARC types of housing. I'm going to skip through these. This is our procedure on how to get somebody in. This is I left this slide in because Mike Allback's phone number is on here. So if you do have questions about this type of housing, adding it to your community, Mike is more than willing to provide his knowledge. He's been doing it for many, many, many years here in Broward County. So he's always trying to help out. So I'm going to skip through these slides. Does anybody have any? Do we have any questions, Rebecca, in the chat that may need to be addressed? Let me see.
I don't see any right now. If y'all have any questions, please go ahead and post them.
All right, great. Thank you, Rebecca. Okay. So, and again, I left some of these content, part of as an ME, we have a lot of calls from out of county, right? We have frequent contact with the other managing entities within the state. Okay, so there is a question. Let's see, Robbie. Will there be an increase for people applying for Section 8? Let me see here. Applying for Section, I'm looking at amount of money that they will receive. Will there be an increase for people applying for Section 8 vouchers in 23? Well, HUD actually establishes the rents based on zip codes. So, for instance, the various zip codes within Broward County have various amounts that are allowed for the voucher. Say, for instance, if a person is in downtown Fort Lauderdale, the um, allowance that HUD provides for, say, uh, the Fort Lauderdale area may be higher than it is if you're in Pompano. So it is adjusted, but it's according to HUD's guidelines. It's been a challenge though. That has been one of the main challenges is finding housing with people that have housing vouchers, finding housing and landlords that are willing to accept the housing vouchers because the rents have gone up so drastically high, even higher than what HUD allows. So in instances when that is the case, we can take it back, and we've had to take it back to HUD, specifically into the housing authorities to petition to see, say, listen, it's off by say $50. Are we able to increase it so this person doesn't lose this opportunity, this housing opportunity? We have over 200 individuals and families that have housing vouchers that are still looking for housing here in Broward County. It is that dire, these costs of housing that we have right now.
I see another one asking, is this specific to Broward County? Are these services only in Broward County that you're talking about today?
Not all of them, no. A lot of the stuff I am referencing, like the public housing authorities, the COC, how those operate are generally throughout the state. I'm providing examples of, well, the FARR Certified Recovery Homes are throughout the state. Oxford House is throughout the country. So all those types of services are um, available throughout the state. Some of the local stuff that I am including, and including these next slides that are coming up, is part of, we get a lot of calls from, um, other MEs where an individual may have, say for instance, they're in a forensic facility up in the Panhandle or whatever, and they're from Broward County and they want to return to Broward County because they're familiar with it, their family's here. So we as MEs will work together to try to get that person transferred down. When you want to transfer somebody down, you want to make sure that they have a place to go to, that they're not just coming to the homeless shelters. You want to make sure that person has health care, behavioral health care, if they need substance use health care. We want to make sure that they're linked with those services prior to coming back to our community, because we know that's the best opportunity for that individual to thrive and to do better. Right? So that's why I leave some of these slides in here, because these are the contact information for some of these programs that are accessed by many of the other MEs here in Broward County, so or in throughout the state. So go ahead, Rebecca.
I saw one more question. Do you have time for more right now, or do you want to pick up?
Yeah, we can take one more and then we'll move on. Sure.
Okay, a person asks, how long can a person remain in the mental health transitional housing after leaving a mental health hospital?
Well, it depends. It depends on the funding. Obviously, a lot of the funding, if they're self-pay, they can stay there indefinitely. But if it's being funded by, say, Broward Behavioral Health Coalition or one of the behavioral health agencies, there's obviously a limit to how long we're able to pay for somebody, which is why, and I'm going to go into, we review utilization management on an ongoing, frequent basis. So, but these are some of the contact informations for local here in Broward programs. I do this, I leave these in based on individuals that need to contact us to try to get somebody back here in Broward County. It's a resource. All these are resources that we have available for people to come in and transfer to. All right, let's see. I'm going to click through these real quick. these are our contacts that I work with, my coworkers that I work with. We do have a FACT team here in Broward County, Florida Assertive Community Treatment team. Lorena Bahia is the contact person for that. We have a forensic multiple disciplinary team, FMT contact with its Esther Jimenez. A lot of the reason I list these is because we do have a lot of people that are returning from the forensic facilities, coming back to Broward. They want to stay in Broward. So I want to provide these contacts because this is the best way to, help an individual that wants to return to Broward County come back, and vice versa. If you have somebody in your community that wants to go to, say, an LSF community provider, they're from the Jacksonville area and they want to return, that the ME is the agency that you would want to contact to try to help, with that coordination, that care coordination. Just again, these are some of the list. So some of the other opportunities or options for placement for individuals that are having behavioral health needs are short-term residential treatment programs. We have one, we actually have two here in Broward, but one is called the STAR program. It's on the state hospital grounds here in Pembroke Pines. It's called, it stands for Short-Term Residential Safe Transition and Access to Recovery. So short-term residential treatment programs basically are a step down from a CSU or an acute inpatient needing more extended but less restrictive level of active treatment or psychiatric condition. So basically, when a person's Baker acted or in an acute care facility, one of the local hospitals, maybe they don't necessarily meet the criteria to be discharged to residential treatment as of yet, or they don't meet the criteria to be to go into the state hospital. So these SRT, short-term residential treatment programs, have been put in place as a diversion to the state hospital. Again, state hospitals are extremely expensive to keep people in. So one of the key things to understand about these types of housing or this type of residential placement is that if an individual is screened and accepted for these short-term residential placement, a person has to go from either the acute care facility into the SRT. Okay, they can't transfer somebody to the say a homeless shelter and then into an SRT. It has to be, so to speak, a custody to custody transfer. So these are a great opportunity for individuals that may need to be in a locked facility, but not necessarily a state hospital. These are locked facilities. We do have two here in Broward. We have a new one at Henderson Behavioral Health, has a crisis stabilization unit that's brand new. They have some SRT beds there as well. And again, they're locked facilities. So you may have an individual that needs that level of care. This is some of the services: 24-hour supervision, individual groups and family therapy, medical and psychiatric treatment, social and recreational activities inside and outside the context of the facility, discharge planning. Of course, every residential treatment program that we're talking about, or respite program or transitional housing programs, everybody needs to understand that when they're placed in these types, if it's not permanent housing, it is very, very important to understand that discharge planning, just like when somebody goes into the hospital, discharge planning starts right away as soon as they move in, because a lot of these programs aren't permanent housing situations unless they're going into their own apartment, an assisted living facility. Some of the transitional housing opportunities and options, as long as a person's willing to live in that type of situation, those can be indefinite. But it's very important for case managers, peer support specialists, supervisors, everybody involved in that person's care, to start discharge planning right away, right when they go in. Otherwise, the days that they were approved for in those facilities are going to come up quick, and then you're going to be scrambling around as to where this person's going to go next. So highly recommend doing discharge planning pretty quickly as soon as they move in. So again, 18 years or older, psychiatric or psychological evaluation ordered Referral from a CSU, again, they have to be transferred from a CSU, inpatient unit, or a designated public or private facility. So individuals from, say, jail could be transferred into a short-term residential program as well, or short-term residential treatment program. Again, LOCUS is something we're going to go into. It's a level of care utilization system. It is a tool that is used throughout Florida to kind of give a range of level of care that a person may need to go into one of these facilities. Authorization, and we're going to talk a little bit about authorization parameters, and you all can understand what authorization parameters will be in a few slides here. So generally 90 days or less for initial authorization, and of course, if a person needs to stay longer, that can be arranged. Let's see. So some of the residential treatment facilities are community-based residents for individuals exhibiting symptoms of mental illness. These are individuals are in need of a structured living environment. These facilities were designed to provide residential care with an overlay of coordination or coordination of mental health services. So these RTFs, residential treatment programs, are not locked facilities. Okay, there aren't any locked residential treatment programs besides the SRT. SRTs are locked. So if you have somebody that may be a risk of wandering or elopement, then you may want to consider trying to get them into an SRT level of care. There are some designated forensic residential treatment programs that are specific to individuals that are have been deemed by the court to be incompetent to proceed or not guilty by reason of insanity. There are those are specific to individuals with those designations. So that is another type of housing opportunities throughout the state. We have one forensic residential treatment program here in Broward, but they are scattered throughout the state. The best way to obviously try to access those is again to contact your ME housing coordinators and to work on discharge planning opportunities for those individuals. Some of the services that are provided in residential treatment facilities, of course, medication management is key for individuals to stabilize, right? Psychosocial rehabilitation, individual counseling, and case management services. Everybody that goes into a residential treatment program, whether it's SRT, level 1, level 2, level 3, they're all required to have case management services or peer support services. These are key. Life skills training in a home-like environment that foster independence. Ultimately, what they're trying to do is to prepare an individual to be able to live independently on their own. They're, you know, in the old days, honestly, the old days, not too long ago, discharge planning for individuals that were coming to residential treatment facilities was to go into assisted living facilities. But the cost for assisted living facilities has gone through the roof. I mean, I think the cheapest assisted living facility that we have here in Broward County is $2,500. And if a person's check now is $914, there's not a whole lot of opportunity for the individuals to go into that type of housing. And most, if you ask pretty much 99% of your individuals that you work with, where they want to live, they're all going to say they want to live in their own apartment. So that was my experience as a case manager, as a housing coordinator when I worked at Henderson. And that's where we placed people. We had people that were coming out of the state hospital. We placed them in apartments and we loaded them up with the supportive services necessary to keep them in those types of housing situations. So this encourages individuals to seek independent living. Again, we want to encourage individuals to go into independent living. Eligibility, they have to be 18 years or older. There are some youth residential treatment programs. I work on the adult side, so I didn't provide any youth information, but they are out there. An individual must be diagnosed with a severe and persistent mental illness, psychiatric evaluation completed within the last year. They have to be continent of bowel and bladder, which is done on a case-by-case basis, because this is not, residential treatment programs are not assisted living facilities. They are not nursing homes. A lot of the nursing homes and assisted living facilities have CNAs that can maybe change somebody if they have that situation going on. They have to be able to function in an unlocked facility. So these facilities, again, they're not locked. They cannot be a danger to themselves or others. They must be able to self-preserve. Aggression is to be assessed. So the reason I put this in there is I actually used to do the jail screenings for Henderson when I worked there. I've probably done over 2,000 screenings in the jail, essentially assessing people whether or not they were willing, because residential treatment programs are all voluntary unless you're being designated to go to the state hospital or an acute care facility. They are all voluntary. So obviously, history and research shows that if an individual is willing to participate in their treatment, that they're going to do far better. So, when I would go out, I would screen an individual. They may have a charge of aggravated assault against a police officer or whatever. So I would go out and assess it in person to make sure what happened in that situation. A lot of times it could have been that resisting arrest charge, could have been that they wouldn't give the officer their name, or they pulled their arm away from the officer when they were trying to cuff them, and then they got that charge. So I always give them the benefit of the doubt to go out and actually talk to them and explain the programs and things like that. It's very, very key to let them know, make them understand or help them understand what they're getting into when they're going into a residential treatment facility. Again, forensic. Again, these, the locus range we're going to talk about here in a few. So these parameters, these authorization parameters, unfortunately in this day and age, authorization parameters are everywhere, right? For even individuals that have Medicaid, if they're receiving case management, you have to get prior authorizations to get case management coverage. And some of them are, you can go up to 90 days. They'll give you 90 days of, and then you have to show and prove that they medically need case management services. So residential treatment programs as well. We have authorization parameters because residential treatment programs are very, very expensive to the system. And obviously research shows that if an individual is in a level of care that they were designated to go to based on the locus, if they're in there too long, say they've progressed, they're doing really well, and they're in there too long because there's no placement for them in the community, they tend to decompensate. So that's why we do these authorization assessments on a regular basis. Okay, so a lot of times initially authorizations are for 60 days. The first staffing is within 30 days. Again, I talked about this earlier. You want to start discharge planning as soon as a person goes into the residential treatment program. I know it's hard because as case managers, you finally got this person, your mental health consumer that you're working with, you finally got this person into residential treatment. You want to kick back and relax, and 30 days later, 60 days later, it's time to try to move them again. So you really want to start that discharge planning as soon as they go into these types of facilities. Again, our level 1, level 2 residential programs are, again, the same kind of authorization parameters. This is pretty much common throughout the state, our MEs. That is part of what, when we're paying for the bed, when the managing entities are paying for the bed, we are, all the MEs are tasked with kind of overseeing whether or not individuals are staying in residential treatment programs too long, because there's a backlog. There's a lot of people that need to have this type of service, and we want to make sure that they're moving along quickly, as quickly as possible, and that they're going to benefit and move on to the next level that they might need. So same kind of parameters for an individual that has to go into a residential substance use program. We do the same kind of evaluations of how long they're going to be there. We staff cases on a weekly basis here at Broward Behavioral Health Coalition. We have many residential treatment programs here in Broward County that we kind of oversee. So we staff them on a weekly basis, making sure that individuals are moving along. And we really encourage case managers to be a part of that staffing, because ultimately the case managers are the ones that are looking for housing and linking them with the services that they need in the community. So we're going to talk a little bit about the level of care assessment. So this is an example kind of how we do it here in Broward, but this is the level of care assessment. Basically, individuals with severe addiction and mental illness often cycle between institutions with minimal therapeutic benefit. There are considerable health and social economic costs to this. Research shows that when the individuals are placed in an appropriate level of care for their treatment needs, utilization of services and recovery is more successful. That's why we talk about when the person's ready even to move on from residential treatment. We want to make sure we get them out into the next level before they decompensate. So we utilize the level of care utilization system, the LOCUS or the CAL LOCUS, which is basically an assessment tool to kind of identify the level of care recommendations. It's basically a quantifiable, it's used throughout the state. So it provides a quantifiable measure to guide an assessment, the LOC placement decision, continued stay criteria, as well as other clinical outcomes. So we're going to go into the various levels. So this is some examples of the level 1 LOCUS, so the level of care utilization system. So this is recovery and health maintenance, a level 1 management. Low intensity level of care, lives independently in the community, usually stepping down for more intensive treatment. Okay, does not require frequent or contact with professionals. So they may have a peer support specialist, a case manager that visits them once a month in their community setting. Level 2, low intensity community-based services, more intense than level 1, obviously. Clinical services that may be provided upon up to once a week. Entry level for clients presenting with minor disturbances. Supportive services should be available. So this individual may need peer support, case management services once a week. So then we go into some of the, part of what the managing entities do throughout the state is we work with those individuals that are high utilizers of behavioral health services, hospitals, residential treatment programs, and things like that. So we have care coordination teams that are throughout the state. The best way to get involved with those is to contact your managing entity to see about if you have a high utilizer, somebody that's been hospitalized at least 3 times in the last 6 months. Some of the parameters, we have these care coordination teams in place to try to help ultimately we want to keep people out of the hospital and try to help promote their health the best we can. So client needs more intensive attention, structure, and contact, usually several days per week for several hours per day. Greater capacity to provide clinical services and greater availability of clinicians. Case management is usually more extensively at this level of care. Mobile service capability, daycare, and rehabilitation services. So there may be a case manager, a peer support specialist, and a therapist all on a CCT team, right? So all those types of services can be available to that individual. You can have up front, initially, if a person's in the community, you're going to have a lot more contact with that individual up front. And then those services can slowly be titrated down to where they might not necessarily need that level of intervention. Level 4, medically monitored non-residential services. So forensic multidisciplinary teams, so the FMT and the FACT teams, Florida Assertive Community teams. Basically, these are more intensive teams, call them hospital on wheels sometimes. Great deal of structure, support, and monitoring. Does not require an on-site living situation or treatment. So these individuals can live anywhere in the community generally. Usually, individual that is on the FACT or the FMT teams are not in residential treatment. So they're in the community, say in their own apartments, or they might be in an assisted living facility. Services have 24-hour availability of clinical support, monitored closely with daily contact and treatment providers. Service such as intensive case management, rehabilitation services are also available. FACT and FMT individuals do not attend PSR programs, so they don't attend day treatment. So they get their interactions from these FACT and FMT teams. Very, very intensive services. These FACT teams and FMT teams are throughout the state. The best way to contact to get involved, if you have somebody that meets that criteria, is to contact your ME and the housing coordinators and care coordinators that are working for your MEs. Level 5 is medically monitored residential service. So these are your RTFs, your SRTs. These are a great deal of structure, support, and monitoring. Services have 24-hour availability of clinical support, no capacity for secure care, or no ability to place somebody in seclusions or restraints. Maybe a step-down service. So the SRT is a step-down from an acute care facility. Liaisons with community care providers and case management. So individuals that are in this type of housing are going to have case management and be linked with a service network service provider that's in the community. And then lastly, level 6, medically managed residential services. So these are the individuals that are required to be in inpatient settings, such as the crisis stabilization unit, acute care facilities at the local hospitals. They may be in a detox unit at one of the local hospitals or detox facilities. Treatment provided in a hospital setting, although it does not need to be in a hospital. Acute and chronic persons with mental illness, secure setting with availability of seclusion and restraints. So these are your more, they are able to restrain and have some seclusion in these types of facilities. Admission and treatment can be voluntary or involuntary. So obviously, if a person gets Baker Acted into a facility, they have an opportunity to obviously stay on their own once they're well enough to make that decision. So I'm not sure if we have, Rebecca, we have any more chat questions? Might be a good time to address some of those.
Yes, I see someone asked, can you clarify or explain if a person was admitted in the hospital either for being Baker Acted, having active psychosis or drug overdose or addiction, do these individuals qualify for bridge transitional housing, recovery home, short-term respite programs? Do they qualify for those?
Well, essentially, if they're in the hospital, they were Baker Acted, obviously they would have to no longer meet the Baker Act criteria for staying in the hospital. But those individuals, if they're ready for, say, discharge from the hospital, then yeah, they would qualify. One of the parameters that we have in place is that they have to have identified a place to go to after the bridge or transitional respite programs. So essentially, if they're maybe it appears that they need more high level of care or residential treatment. So the hospital would make a referral to the residential treatment programs. They would be screened, individual be screened, accepted or declined. Say they're accepted to residential treatment program, then they would then qualify to go into one of the respite or transitional housing beds while they're waiting for that residential placement to happen. So hopefully that answered your question.
And then another question was, are there housing and residential programs for pregnant women or women with children?
Yes, there are. They're few and far between, unfortunately, but actually Oxford House, the two that I had listed as Broward contacts or whatever, they do accept women and children, actually. And actually the Village South is one of our providers here in Broward County. They do take women and children as well. So yeah, I would definitely make contact depending on the area that you're in, make contact with your ME housing coordinators to find out where. Oxford House are throughout the state, throughout the country. So a lot of times they do have opportunities for, women and children as well.
Another question was, someone didn't know what the acronym LCD meant. Can you tell us that acronym?
Oh yeah, LCD is local coverage determination. So basically, they're essentially trying to figure out whether or not that level of care is appropriate for that individual. So,
That's all the questions I see for now.
okay, all right, we're going to move on. And this is just a little a number here that I put in the middle of this slide because permanent housing, Section 8, transitional housing are not emergency housing interventions. The reason I put this in here is because I field questions and phone calls all day long, right? We all do as behavioral health providers, even as the ME, um, you know, frequently, especially now with the housing market the way it is. Um, Everything is an emergency. Obviously, if your home is, you're on the street, it is an emergency. But unfortunately, these housing options that we're talking about, everything has a wait list. There is no emergency housing interventions. Even emergency housing shelters have wait lists. Um, and again, the continuum of care only serve individuals and families who are literally homeless, so the category 1, or the fleeing of domestic violence, category 4. This is a good resource here to utilize. Housing insecure or at-risk households can be served by calling 211. 211 actually is throughout the state. It's actually throughout the country. And then 988 is obviously the brand new phone number when you have an individual that may have some suicidal ideations, a crisis lifeline. We are trying to expand and get this up and running here in the state of Florida. It is a crucial thing that they're trying to change, obviously, with making sure appropriate people are responding to mental health consumers that are having concerns in the community, rather than always bringing in, police officers and things like that that might not necessarily have the training necessary to, assess the situation to where we can make it safe for an individual that's experiencing some mental health issues. So 988 is a good number to have on in your memory bank. Housing authorities sometimes have affordable housing rentals. I'm going to give you, there are some links in this resource guide that I have here where you can be able to look and search various housing options for some of the individuals that you work with. Program eligibility requirements are based on programs funding and source. So obviously, individual has to meet the criteria for that specific housing need or source. Okay. So I know you heard me talking about the Homeless Management Information System referral process, HMIS. So again, these are, we use the HMIS system here in Broward. It is definitely used throughout the state of Florida with the Continuum of Care and the coordinated entry teams. I just want to leave this slide in here because these are essential items that if you're beginning to work with a mental health consumer or substance use consumer, any of the clients that we work with, you want to make sure that you're gathering these documents, copy of their ID, copy of their birth certificate, copy of social security cards, proof of income if they have it. These are essential items for life, really, but these are very essential to having the process of applying for public housing authority vouchers and certificates, applying for social security benefits. These are necessary items that a person should have on hand regularly, readily available in order for processes to, we have people that, can apply for social security benefits, but if they don't have a copy of their social security birth certificate, they might not necessarily be able to get their check started. These are just essential forms and documents that I highly recommend that you all keep in their files. Keep a copy of it. Verification of disability, obviously, if they're linked with a behavioral health agency or hospital, we would obtain some of these verification of disabilities are required for some of the housing vouchers and certificates that you're applying for. These are items that we upload directly into the HMIS system because the housing authorities actually access the HMIS system when they're assigning or calling in people for their appointments. And these are the items that they need when they come in for their appointments. So documentation of chronicity. So those of you that are case managers, peer supports on the call, or even therapists, whoever's documenting, if you know an individual is homeless on the street, say you're visiting them and you visit them for the last 6 months, and it's been, you met them at the Wendy's behind, you know, uh, on Broward Boulevard or whatever. So basically, you as a provider can document their homelessness, right? So when you're progress noting, you're going to express that each time I met this individual, they, may be unkempt. They are reporting that they're living behind the dumpster at the Wendy's parking lot. So these are, as an agency, a behavioral health agency and a provider, you're able to verify a person's homelessness. And documentation of chronicity. So some of the vouchers that I talked about earlier from the public housing authorities require that a person is chronically homeless. So chronically homeless means that they've had 4 episodes, or well, actually that they're homeless for 1 year straight, or they've had 4 episodes in the last 3 years. And those 4 episodes actually have to equal 1 year. So if there's a chronic voucher that's available, you would want to make sure that that individual has that documentation demonstrating that they've been chronically homeless. An individual that's chronically homeless is generally going to have a higher SPDAT score, the VI SPDAT that we talked about, and they're more vulnerable. So we want to make sure that we're getting the most vulnerable people off the street. So in regards to that, this rental net. I'm not going to talk about that. That's here locally here in Broward County. Miami-Dade has their own rental net multi-listing. It's basically it's a website where case managers, landlords can list their properties, and they're very they understand the program, so they know how the Shelter Plus Care vouchers work. They know how Section 8 works. So the landlords that list in these types of multi-listings have an understanding of our programming, the people that we work with, the clientele that they're renting to. So it's another resource for the case managers and the housing navigators to be able to access. This is one of the another type of emergency housing vouchers. These were put down from HUD to the local housing authorities, the public housing authorities in your community. Basically, an individual has to be homeless, at risk of homelessness. We were given about, I think, 256 of these vouchers between 2 of the housing authorities here in Broward County. The other housing authorities throughout Florida also received some of these. We've already dispersed them, okay, but we are still taking these emergency housing voucher referrals. We're still entering them into the HMIS system, hopefully anticipating that we may get more. And then we also have we'll have a list to work off of. So you may want to contact your COC to find out if any of these emergency housing vouchers are available. You can also contact your public housing authorities to find out if any of these are available in your community. But these are very, very good vouchers. The individuals only pay 30% of their income towards rent once they receive them. And again, they're parameters though. You want to make sure that the individuals that you're working with meet the parameters that are listed here on this page. And as well, this is just continuation of the eligibility criteria. But I highly recommend contacting the public housing authorities or your local COC to see if these are some of the housing vouchers that may be available in your community. One of the other programs that we talk about, Shelter Plus Care. So the HEARTH Act consolidates the 3 separate McKinney-Vento homeless assistant programs, including supportive housing program, Shelter Plus Care program, and the Section 8 Moderate Rehabilitation SRO program into a single grant program known as Continuum of Care. The former Shelter Plus Care program provides rental assistance in connection with matching supportive services. So essentially, the shelter is provided by the public housing authority. So HUD provides the money down to the public housing authorities, and then the public housing authorities then assigns say a voucher or certificate or a series of vouchers or certificates to a housing provider in the community. For instance, here in Broward, Henderson Behavioral Health has a shelter plus care program. So they essentially get funding from HUD to provide, say, 20 vouchers to individuals that are experiencing homelessness and need supportive services. So Henderson is tasked with providing the supportive services, and then the housing authority who provides that voucher provides the voucher in the funding, and then they work hand in hand together to try to locate an apartment for an individual. And then the case management, the supportive services continues to monitor that individual. Key components of keeping people housed, in my opinion, is one, case management services, peer support services, regular visits. People I placed in housing, and we're going back now, we're going back by 25 years at least, are still in their apartments today. And I attribute that length of stay for people that were coming out of the state hospital, acute care facilities, and things like that prior to getting linked with these programs is the case management supportive services that are provided. And then also, highly recommended if an individual has struggles with managing their funds, payee services are a great opportunity for individuals to be able to maintain and stay in their housing. So there are many payee services throughout the state that can help manage a person's funding so they can maintain their housing. So bills are paid from the payee, or pay the bills up front, pay the rent, the electric bills, and those sort of things. So very key into keeping people housed. These are, again, some of the other voucher types. Mainstream vouchers. Mainstream vouchers, this would be one of those public housing authorities announcements that I had mentioned earlier. They may put a notification out that on January 10th, our mainstream voucher program is open up to the community. Please call in, please log into the computer on the 10th and try to register for these. So the vouchers must be used to assist non-elderly. So this is the criteria specific to the mainstream vouchers. Used to assist non-elderly persons with disabilities and their families. The non-elderly person with disabilities must be at least 18 years of age and less than 62 years of age. The eligible household member does not need to be the head of household. So if it's a family and there is a person that is disabled that meets the disability criteria, it could be a child that's in the household. So that is a key part of these mainstream vouchers. Eligibility for the voucher is determined at the time of new admission when the housing assistance payment contract is signed. Non-elderly persons with disabilities who turn 62 after being admitted will not lose their assistance. But this would be a voucher where you wouldn't want to apply, say, have that person call in, say they're 63, and the announcement comes out, you wouldn't want to have that person call and try to register for this mainstream voucher because obviously they don't meet the criteria based on their age for the certificate. You want to make sure you steer them in the direction of the housing voucher certificates that they may qualify for, that they meet the criteria for. Here's some more non-elderly persons with disabilities. So the disability is defined by 42 United States Code 423. So basically somebody that's been determined by the Social Security Administration to be disabled is determined pursuant to HUD regulations who have a physical, mental, or emotional impairment, is expected to be long, continued, and indefinite duration, substantially impedes his or her ability to live independently, is of such nature that the ability to live independently could be improved by more suitable housing conditions. Or a person can have a developmental disability as well to meet the criteria for these type of mainstream vouchers. This is just one of the samples of an organization that receives funding from our HOSD, or our HIP administration, Homeless Initiative Partnership Administration. So they receive the funding from HUD, goes down to our HOSD program, and then they contract or provide HUD funding to. This is one of the organizations, Broward Housing Solutions, receives fundings for multiple different programs that they have. This is just an example of how it works and what can be done with HUD funding. You know, they started a program for veterans. They started a program for seniors. They started a program for foster youth that are aging out of foster care. So they've spread the money out to kind of help the various aged individuals and backgrounds that they have here in the community. So this is just an example. So veterans, we come across a lot of homeless veterans, a lot of veterans within our field throughout the state, especially in the northern part of the state, because there's a lot of, well, and even in Tampa, there's a lot of veterans bases and things like that. So veteran housing assistance, which is supportive services for veteran families, so SSVF programs. We have 2 veteran programs down here, SSVF programs down here. Operation Sacred Trust is one of the organizations down here. They both serve Broward County and Miami-Dade. If you click on this link, once you get this PowerPoint presentation, if you click on the main link in the orange part here, it will take you to all of the SSVF programs that are in the state of Florida. And this is a countrywide program. Essentially, it is a program that provides rental subsidies, case management services, linkages to the VA benefits. They help people try to get benefits linked up with disability benefits, the VA benefits, that sort of thing. So these are really great programs that are in place. So one of the things I want to talk about too is if an individual is homeless on the street, you learn that they're a veteran. You would want to steer them in the direction of one of these SSVF programs, as opposed to steering them in the direction of trying to obtain, say, a shelter plus care voucher. Because yes, would they qualify for a shelter plus care voucher? Of course, you know, if they have the, you know, the background, the disability, and that sort of thing. But they would, a regular person that doesn't have veteran status would not qualify for a HUD VASH voucher or SSVF programming services. So we want to make sure that we're steering the veterans. There's a lot of money that's involved for these SSVF programs. There's a lot of a real big push to try to end homelessness for our veterans, and rightfully so. So these are excellent programs throughout the state, and a good resource if you're coming across a lot of veterans that you are working with. Again, we have another one, a second one here, Mission United, which is affiliated with United Way of Broward County. Again, this is another SSVF program. And again, these are best way to access the ones in your area is to click on that website link. It will bring you right to those services within your area. So this part of my housing training and resources that I provide are related to my other hat that I wear, which is the SOAR local lead. So I'm the SSDI Outreach, Access, and Recovery local lead. So years ago, I was trained as a SOAR benefit acquisition person. Actually, I was a case manager, and I was trained in the SOAR model. Okay, so the SOAR model, and we're going to play a short video here in a few minutes. The SOAR model basically is it's a training that can be taken online. The link for that training is on this page. It will take you directly to the SOAR website. It's a free training. Here in Broward County, we were requiring that every case manager be trained in this. We've kind of moved away from that because what we were finding is lots of people were being trained because they were required to be SOAR trained, but they weren't using it to apply for Social Security benefits for people. So essentially, SOAR is a method, teaches case managers, benefit acquisition staff to how to properly apply for Social Security benefits for individuals that are experiencing or at risk of experiencing homelessness. Because Normally how it works is an individual, it takes a lot longer if you do it the old way. So this is a more concise. The video that we're going to show is going to demonstrate specifically how the process works. Um, but if you're interested in becoming SOAR trained, um, the link on here for the website will have the local lead that's in your area. So the local leads for the state are listed. The state SOAR representative, Teresa Bernal, is also listed on there. All of our contact information for the SOAR local leads are on that website. And then also access to the course. There's a children's course and an adult course. So if you work with children, a good idea if you're going to be somebody that's going to be helping individuals apply for Social Security benefits, it's a good idea to take that course. It does take about 20 hours, but it's very detailed. What happens is they'll assign you a vignette or a case, so to speak, and essentially when you're working the course, you're going to actually be doing a practice application from start to finish uh, for that individual, for that case that you get assigned to. And then you turn it in to the SOAR TA center, and then they review it. They give back really, really, really detailed information, not criticism, but constructive criticism, or not even criticism. It's constructive guidance on maybe you should have done this or how you could do it better. But it's very, very detailed. It is an excellent, excellent opportunity to become very, very familiar with the Social Security Administration and the process. But Rebecca, are we able, or Eric, are we able to show that video now? All right, perfect. Thank you. Okay, thank you for sharing that. So as you can see, obviously the SOAR process obviously makes it much quicker. And we found great success here in Broward. We actually have a benefit acquisition team that is affiliated with one of our providers. But on average, the on initial application across the country, 65% of the initial applications are approved. But here in Broward last year, this past fiscal year, we had 88% of our initial applications were approved. With unfortunately the pandemic did affect how long it took for a decision, but it was far less than it would have been done in the um, the regular way before a SOAR person was involved. So again, these are the links to if you're interested in becoming a SOAR trained person. And I even if you're not, if you click on their website, it is a valuable, very valuable information about all kinds of stuff. They have information about they have a lot of information about, say, for an instance, somebody that you know, one of your clients has already receives SSI, and they want to work, but they've always been told that if they work, that they're going to lose their benefits. The SOAR website can provide information based on the rules of Social Security, where you can explain to your client that actually that's not the truth, actually. So very valuable training. So we're going to move on to the next slide. So I want to real quick talk about power of collaboration. As an ME housing director, we recently presented at a supportive housing conference in St. Pete. But part of that is having people in the room. When we're out about and about our days or whatever, we talk about what we do for a living and things like that. So the power of collaboration, I really want to stress the fact that all of these organizations and agencies that are listed here were very much involved in. So for instance, FARR Supportive Housing Services is an affordable housing builder here in Miami-Dade. They've always wanted to, and they've been working and striving to build in Broward County. Unfortunately, land in Broward County is few and far between. It's very difficult to build here. There's a lot of development going on, but it's not affordable housing. But I remember when my affiliation, when I was a case management supervisor, I had case managers that worked for the OST, the Operation Sacred Trust program. And Stephanie Berman, who is the president of FARR Supportive Housing Services, her husband ran the OST program. He still does. So there's a connection there. So, and I remember years ago talking about a vacant site that was on the state hospital grounds here in Pembroke Pines. And we initially I know they were trying to build on that site, but there was a lot of pushback, a lot of, red tape involved. So they kind of, put it off to the wayside. But then came along NAMI, which our local NAMI is the National Alliance for Mental Illness. There's a couple of NAMI advocates, and they actually call themselves the NAGs. I have a lot of contact with them, but they're essentially they have family members that have mental illness, and they're very big advocates on trying to improve the system. So we got together, me and the NAGs, basically. We got together and we started nagging people. We went to the city of Pembroke Pines to see about that vacant piece of land. And it turns out the land was owned by the Department of Children and Families, and the Florida Department of Environmental Protection had a stake in it as well. So there was like some subleases, leases, and subleases that were involved. And the city of Pembroke Pines weren't really interested in having built on that site because they had built one for 55 and older, but they were running it. So FARR is an expert at running these types of facilities and housing programs. So we went to them and we talked about it because there was a notice of funding, an RFA that was put out for people with disabling conditions to be able to receive funding for building affordable housing complexes. So we were able to, by collaborating with all of these agencies that are listed here and nagging everybody, we were able to obtain rights or be able to use that land, which was necessary to apply for the RFA through Florida Housing Finance Corporation. We were able to apply, or Carrefour was able to apply for that RFA, and lo and behold, they were awarded that funding to build this 100-unit affordable housing development. They've already started developing it or building it. They just started a couple months ago, but we're super excited because it's going to house one of our providers, Footprints to Success, which is a clubhouse model. And then South Florida Wellness Network, which is a peer-run organization that does a lot of real peer support stuff here in the community. They're going to be housed in this building. The building is beautiful, and it's going to be a great opportunity for our individuals that we work with that have the lower incomes and things like that. 20% of the units are going to be set aside for those experiencing homelessness. So we're super excited. I just want to kind of really just, if you're interested in adding affordable housing to your community, I encourage everybody on the call to talk to everybody, talk to people, because you never know what might come about of it. And we're just excited to have this opportunity, and we can't wait to do another one if we can find the land for it. So just a recommendation, just nag people. So I want to go kind of through, we're almost coming to the close of our thing. We're going to definitely go through and see if we have any questions, but I wanted to go through some of the resources. Again, this is a resource tool that I want you all to use. To click on these links when you get a copy of this, click on these links. I provided you with, these are the contacts. All these hyperlinks work. These are the managing entities here in the state of Florida. Okay, so if you click on the main link, it will take you to their website. These websites actually contain all of the providers that the managing entities contract with are listed on their websites. And then there's links to those agencies. So most of you are probably familiar with your managing entity. If not, this is a way to contact them. And then also I've listed the housing and SOAR individuals that are the coordinators that are affiliated with these managing entities. Okay, so these are a good resource to utilize. My number and my email address is listed there as well. These are, again, some of these subsidized housing search links. These links work very, very well. These are a way to get information about some of the public housing authorities here in Florida. If you click on that link, it will take you to all of the public housing authorities here in Broward, or not Broward, all over the state, actually. And the other link, there is a link that takes you to the public housing authorities across the country. So if you have, for instance, if you have somebody that has a Section 8 voucher and they want to move to Texas, you can click on that PSH or the Public Housing Authority website, find the public housing authority that is located in Texas where that person wants to move, and Section 8 vouchers can actually transfer. Some of these vouchers and housing vouchers can transfer to other states. So we have that a lot. A lot of people are moving and do want to transfer their vouchers, and we assist with that. And we use the Public Housing Authority contacts for doing that. Again, this is just more resources. These are more resources. Fair housing agencies. Click on these links. The Florida Housing Search here, the fourth one down, is it's a link that it's a website that you can go to. You put any city in in the state of Florida, put any city in there, it will bring up the affordable housing complexes that are in that community. It will also bring you up, it will show the apartments. It'll show you some of them have pictures. The prices are on there on most of them. So it is a good resource if you're looking for affordable housing placement for individuals that you're working with. I highly recommend using that website as well. Again, this is a resource guide. These are some of the local resources that we have here in Broward County. If anybody from Broward's on the call and haven't had this training before, these are some of the resources that we have here locally. Again, just an example of resources. I highly encourage you to contact your public housing authorities. We have 2 public housing authorities here that do have aging out of foster care programs. This is a statewide thing, so contact your public housing authorities. Find out who your contacts are for the various aging out of foster care programs if you have individuals that are aging out of foster care. This Florida Housing Search link is the same one from the other page. It will take you to affordable housing listings that are available. And then this is my reference list, right? So all of these reference links will take you to very informative information based on the PowerPoints that I put together. But these links as well will take you to valuable information as well. So I'm gonna field some questions now. If there are any questions, Rebecca, here's my contact information. The best way to reach me is through my my cell phone or email. That is my contact information. But Rebecca, do we have any more chat questions that I can address before we?
I do see one, which was, what do you recommend for Section 8 voucher recipients who are being told that their vouchers are only county specific?
Oh, okay. So, and they're wanting to move out of the area, I assume. So when we have those specific situations, what we try to do is try to talk to the housing authority, because it has to be one that can be transferred. So what we do is we try to talk to the public housing authority to see if there's one that is available that can be switched out, traded, so to speak. We do this a lot. We've done this with Shelter Plus Care vouchers, where there was some openings in the Section 8 voucher world. We would have it switched by the housing authority into one that was transferable. So definitely recommend calling the public housing authority to see if they have any available vouchers or certificates that can be transferred to that individual because they want to move. And often, if they have availability, they will do it because it helps people be able to transfer and move to where they want to live.
And it looks like some people are just commenting a similar sentiment, just that there is not enough housing for people to be able to use the voucher. Pretty much, it seems like, just from the places people are mentioning, all over the state.
Yeah, we have that. Unfortunately, Florida is a prime spot. Interest rates have gone up, so it has alleviated, or it has it's caused people that can't afford to buy homes now are competing with the clients that we work with for the rental market, right? So there's not enough inventory, which is why we're trying to add more affordable housing buildings. We actually are a centralized homeless assistance center, or our HAC, our shelter, actually built a 72-unit affordable housing complex in their parking lot. So it's actually done. They're going to be probably leasing up within the next month or two. But we have to think outside the box with affordable housing and being able to try to get these opportunities. I know it's a real push here in Broward County to try to add affordable housing, not just for the low-income individuals that we're working with, but also the case managers and the police, and affordable housing for people that are working, but the costs are extremely high. So yeah, I concur with that sentiment.
Well, I just want to say thank you so much on behalf of FATA and Department of Children and Families. We really appreciate all the time and energy I know it took to put this presentation together. So So we just want to say thank you very much for that. And if anybody has any other questions, as Mr. King already said, he's given his email, his cell, it's all in his PowerPoint, and it's on the screen right now for you if you need it or have any more questions. So I just, again, want to say thank you. And I have a few more closing announcements for everyone, but I'll let Mr. King say his final goodbyes, and then I'll fill you in on all of those.
All right. Well, thank you, Rebecca and Eric, for your assistance in putting this this presentation together. I hope everybody gained something out of this, and you know, you can use the resources that I provided. And again, I'm open to you know, if you want to call me or email me with questions, I'm here to help. But thank you again for having me.
Thank you as well. All right, everyone, please see the chat panel for a link to today's survey. Additionally, when I conclude today's webinar, your web browser will take you to an evaluation on FADA's website. If you want to receive CE credits or statement of credit for this event, you must complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE broker for Florida licensed healthcare practitioners, you must have provided an accurate Florida Department licensed health and prefix number when you registered for this webinar. After you register or sign in, you will be directed onward to the evaluation. You must use the same email address you used when you registered for our webinar and when you set up your FADA profile. This is the only way to connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email that you will receive later today. Please remember the evaluation will close Tuesday, January 10th. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your FADA profile 30 business days after the evaluation closes. Thank you again for participating in today's webinar. We'd also like to recognize and especially thank the Florida Department of Children and Families, Office of Substance Abuse and Mental Health for funding today's education. Thank you all and have a great rest of your day. Please make sure you do your evaluation. Thank you again, Mr. King.
Thank you. Have a nice day.
You too.